Okay, so we're going to assess the lumbar spine, and we're going to do active range of motion, and not really overpressure with this because the upper trunk really acts as overpressure. You can apply it, but it's not always necessary. Then we're going to do some resisted testing, and then I'm going to put Fatty on the table and do some joint play and palpation of the lumbar region. So Fatty, what I'd like you to do first is to do forward flexion. So go down as far as you can, and what you want to look at is the length, how far he can reach, and you want to look at how flat or how round the lower back is. Okay, and come on back up. Great, he's got great flexibility. Now, could you just step forward about 6 inches, stop, and can you do extension for me? Great, and what you want to see is that there's extension happening in the low back, and it's not being all by the pelvis and by the hips doing the movement, and come back up to center. Great, could you do lateral flexion to your right, so you can touch your right hand to your knee? Great. And notice the upper body has weight, and it applies a type of overpressure, so overpressure isn't needed from an external force. Come on up and lateral flex to the left. Great. Same kind of movement. You're a little bit more limited in that direction. It's a little tighter on the lower back here. And when you're examining somebody's on their active range of motion, you should be palpating and touching and feeling the low back and looking for movement. Come back up. Now, could you cross your hands in front of you? And what I want you to do is rotate yourself to the right towards me. Okay? Good. And again, I'm just looking at the amount of rotation, and could you rotate the other direction? All the way. Good. He got more rotation. Seems you have more rotation to the left. Great. So we've covered active range of motion. Put your hands down. That's great. We've covered the active range of motion of the lumbar spine. You want to look and notice the different ranges the person has, if there's any trick movements or any irritation while the person's doing it. And then you want to go on to resisted. And resisted can be done on the table, but it's not quite as stable. So I prefer the person be seated in a chair. So Fatty's just going to grab a chair here and sit down. Great. So what you're going to do from there, you can choose to do flexion, extension, whatever order you choose to. I'm just going to start doing a lateral flexion. So what I'm going to do is apply pressure in this direction, and Fatty's going to stabilize and keep himself in that position. Okay, we're going to do it a count of 3 times for 5 seconds. Ready? 1, 2, 3, 4, 5, and relax. 1, 2, 3, 4, 5, and relax. 1, 2, 3, 4, 5, and relax. Great, and then we're going to do the other side. Doing the internal, external obliques. You ready? 1, 2, 3, 4, 5, and relax. And 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. Okay, now what I'm going to try is I'm going to apply pressure and push Fatty a little forward and see how well his extensor muscles are working. So just resist my movement, Fatty. 1, 2, 3, 4, 5, and relax. And 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. Now, Fatty, could you sit up on the chair just a little bit? So I'm going to push you in extension. Great. So I'm going to apply pressure again in extension and check out his rectus femoris, or rectus abdominis, not rectus femoris. Okay, ready? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. And the last ones we're going to do are rotation. So, Fatty, could you put your arms across? Great. And what I'm going to do is I'm going to pull in this direction, and Fatty's going to resist that movement. Ready? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. Okay, and we're going to shift and do it the other direction. Okay, ready? 1, 2, 3, 4, 5, and relax. And again, 1, 2, 3, 4, 5, and relax. And one more time. 1, 2, 3, 4, 5, and relax. Great. So now we've tested the abdominal muscles, internal, external oblique, rectus abdominis, and we get a sense of strength, the person's individual strength. And from there, we do joint play of the lumbar spine. So could you get up? Great. I'm going to pull this table right back, so I think we can see it just fine there. And could you come up on the table? Now, you won't be able to see this all that specifically. It'll be shown to you more specifically in class. But what you're going to do is you want to check out the lumbar vertebra from L1 to L5. And again, the same as the cervical spine, you want to do posterior anterior glides, transverse or rotational glides, and you can also do bilateral glides on the transverse processes. So I'm going to find Fatty's L1 and apply an anterior anterior pressure, or it's actually called posterior anterior according to McGee's. And then I'll do a rotational or a transverse, putting my fingers on or my thumbs on the spinous process and applying a rotational pressure. Again, a sustained grade 2 for all of these. An anterior pressure, that moves very nicely, Fatty. That was moving nicely. Any discomfort there? Okay, good, good. And a transverse pressure, a transverse force or a rotational force. And I would continue on down all of the vertebra, getting a sense of feel of the movement or lack of movement or sensitivity, or sometimes you see muscles. If the area is sensitive, the muscles will kick you out. Literally push your thumb off of the transverse processes or spinous processes. And coming down to L4, applying pressure there. And anterior. Great. Again, a sustained grade 2. And after you've thoroughly gone through the joint play for the vertebra, what you want to do from there is you want to palpate the erector spinae muscles specifically. You want to get a sense of feel of density, temperature, texture, tone, any contractures, myofascial trigger points. You want to palpate the QL muscles, quadratus lumborum, for any myofascial trigger points, and you would do this bilaterally. Okay. You can also, and it's also a very good idea to check out the iliopsoas as well, because the iliopsoas often has lumbar spine or causes lumbar spine or lower back discomfort. Okay. And after you've palpated thoroughly the lumbar spine, and after you finish doing that, you're actually ready to go to Blackboard and answer these questions.